Prostate brachytherapy refers to the direct placement of radioactive sources into the tumor itself. Being able to place the radioactive source or seed directly into a tumor, one can then increase the radiation dose significantly to the tumor and thereby a higher chance of cure and control. By virtue of the large volume that we do here, we believe that translates into better patient experience as well as outcomes. The advantages of high-dose rate brachytherapy versus low-dose rate brachytherapy are that the radioactive seed is placed in the patient only temporarily for about half an hour before it's removed. Therefore, there are no issues with radiation exposure once the patient goes home. This is our dedicated operating room. We have the operating table. The patient is positioned on this table, lying on their back. We then have leg supporters where we raise it so that the patient's leg is upright. The patient will be anesthetized completely, and we then insert a ultrasound, and the ultrasound probe gets advanced into the rectum, and it will stay there for the remainder of the procedure so that we can see where the prostate is and see where the needles are so that we can position them accordingly. We implant between 12 to 16 needles into the prostate through the skin just underneath the scrotum and above the rectum. Once the needles are in place, we then plan the treatment itself.
The radiation oncologist does the needle implantation, and we have a procedure at Sunnybrook where it's all done intraoperatively, so intraoperative ultrasound-based treatment planning. So what we find with this is that the patient is not moved at all during the procedure. We implant needles, we do everything with ultrasound, so we use ultrasound to guide the needles as they're being placed and to also image the anatomy at the same time.
Once we've created the radiation plan, we then connect the catheters from the patient into the machine that will deliver the radioactive seed. The radioactive seed is at the end of a guide wire in controlled robotics and can be advanced very accurately into the prostate. The treatment itself takes approximately 30 minutes. Once the procedure has been completed, the radioactive seed goes back into the machine, so it's no longer in the patient. I remove the catheters and the anesthesia is reversed. The patient is then transferred to recovery, where they will stay there for approximately 1 to 2 hours before they are discharged the same day.
When we deliver radiation treatment, the best results, in other words the higher cure rate, occurs when we give as high a dose of radiation as possible. The best way to do that is to use a combination of brachytherapy with external beam radiation. So a way we have developed of doing that is to target the cancer within the prostate with brachytherapy or internal radiation and reduce the amount of external beam radiation that we need to give from the outside. So this in turn reduces the side effects to normal tissues, to rectum and bladder, but yet still covers microscopic cancer that may have extended outside the confines of the prostate. In fact, our own results with a follow-up now of over 10 years for some patients is really good, showing over 90% long-term cancer control rates.
Our goal of this program is to continue to be leaders in brachytherapy research to better help our patients.